who's extremely credible and influential within the NHS. This is Ade Odunlade. I'll tell you a little bit about Ade before he comes to speak. So Ade is a qualified healthcare leader with a wealth of clinical and operational management experience. And he's experience gained from working in a variety of senior positions over the last 30 years. Wow, that's a lot of experience within the public and private sector. He's highly motivated to deliver clear outcomes and results for patients and staff. Ade has a wealth of knowledge and a demonstrable track record of delivering outcomes. And Ade currently he's a mentor, and Ade asks his mentees not to be passive receivers, but active participants. So I like that. He also encourages staff to honor commitments, expect support, communicate clearly, assume responsibility for their own development, be teachable, and listen to what is being said and not said, especially how it is being said. So Ade currently works as the Chief Operating Officer for Derbyshire Healthcare NHS Foundation Trust, and was formerly Managing Director for CNWL. You know what, Ade, it's so great to have you with us here on He Matters. What a wealth of experience, and I know we are going to learn so much from you today. So it's over to you now. Thank you.
Thank you very much. Thank you for having me here today, and great speakers preceding me, and thank you for all that you've shared. Steve, that was a really humbling experience to hear what you've gone through, and what you're still doing, and making all of that count in the journey of helping people. So thank you very much. The topic that I've been asked to talk about today is about accessing mental health. And I was thinking about this and looking at, by the way, for non-Zimbabweans who are in the audience, what you see behind me is the flag. So, let's so a little bit of knowledge for non-Zimbabweans on the call. In Zimbabwe, for instance, access to mental health services is generally centralized. And the reason why I just want to touch on this is that when you move from one culture to the other, you're going to be influenced by your preceding culture. And when you're coming from a culture where there is very little psychiatric care, and people's beliefs and attitudes towards mental health illness compound this. And as a result of a centralized system, it makes accessing mental health become difficult. And I've listed on my slides, I don't know if the slides is being shared. Okay, if it's not. So we have all these big hospitals and very little in terms of supporting services. And as a result of that, there's also the tendency to believe that mental health institutions are the product of white European culture or the middle class. So that is coming from that background where accessing is pretty restricted, and is more of within the families, within the communities. But today we're talking about men. So the question is, why men? And Ethel at the beginning gave us a lot of statistics. Around 1 in 5 men will die before it reaches 65, 2 in 5 before the age of 75. We know that health over 50 in terms of screening, lifestyle, disease awareness, including diabetes, prostate, erection problems are pretty predominant problems with men. And also, World Health Organization estimates that 1 in 4 people will suffer mental health problems at some point. So this is pretty important stuff. So the question is, why Black minds, men matters? British black men are 4 times more likely than white to be hospitalized for poor mental health and are less likely to seek help before they reach crisis points. And I think it was quite interesting when Ethel was introducing me earlier on. There's something in there which is being a passive receiver or active participant. So in a way, what I would like to ask you and enjoin you today is to be an active participant, to be active in accessing mental health rather than expecting that this will come to you. Do you mind taking us to slide 3 of also? The next one, yeah, thank you. No, the one before. Yep, thank you very much. So, in Zimbabwe, we also know that, and I think it's also about whether you call it generalization or also, but there is a fact that there is a male suicide rates within the society is as well, with the statistics of almost 2,058 between 2015 and 2019 died by suicide, as compared to 505 females during the same period. And these numbers are devastating. And these do point to a much deeper issue within the society. And I don't want us to completely divorce what happens in Zimbabwe to what happens here, because you are a product of the country, even though you might have been influenced by that. So, and a lot of people that have moved over here will still have a whole range of ways in which the culture continues to be a determinant factor. Next slide, please. Before I talked about access in the UK, one of the things that I found extremely interesting is that a lot of work that has been going on in Zimbabwe itself, but also the reason why I put it on the slide is actually the beginning of how we access mental health. This one was Dr. Chibanda, and started about simple act of talking can make a huge difference to people's lives. And that is really important that we engage in having conversation with our friends, with our family, with people around us is really vital to ensure that A, we're able to seek help, B, we're able to discuss some of the pertinent issues that might be worrying our mind, or we might be experiencing some symptoms. So it's really important to get talking. Next slide. This is another one which I think I've put on the slide here as something that I will actually ask people to emulate. We know this started in Zimbabwe recently as part of the stress by COVID, and it's called Friendship Bench. And I think one of the things that I've noticed is that a lot of people are so overworked, underpaid, the work-life balance is extremely poor. And actually, we can start to think about how do we build networks? How do we ensure that people around us we're able to have this conversation that I referred to earlier? And so I will enjoin people that Friendship Bench is actually a good one, that it will be good that men on the score, especially within the community, that you emulate the Friendship Bench, which is part of being able to have a way of articulating and discussing, getting other people's pearl of wisdom in being able to resolve problems. Next slide. So I kind of practice the men mental health support. And actually, this is a support that is available to everyone. There's a good organization called the Beat Stress UK. They offer service online support for men in particular, for all ages. And for a number of us who are midlife, we've heard about midlife crisis and so on, and it's the most significant. And I think it is really important that people use this third sector organization as well. Earlier on, there was a mention of IAPT, which is basically a talking therapy, and there's always one around you. If you either ask your GP, or if you just put in the Google IAPT, you will find that you'll be able to access one around you. And of course, there are links to Samaritans, which is 24/7 online, just by calling 116-123. Again, people have used 999, but my advice is that it's better to use 111. And when you use 111, you'll be able to access support. And of course, you can have emergency appointment with your GP as well. And there are also crisis service, as Steve mentioned there in his presentation. There are a number of crisis service around the country as well. Next slide. So it's really important that my advice is to keep conversation going with people around you, your supportive network, and to be able to access some of those services that are able to support you much early before things become really worse and becomes really difficult to manage. And before we started getting into a treatment that in itself becomes problematic. So early help is always important, and it's really important that these are the things that you can find useful in terms of being able to access support. So my time, I think I'm just on the dot of time that I've been given. So I will stop there. And if there are any questions, happy to take them.
Thank you so much, Ade, for that presentation there. And one of the things that you did mention in there, this is a question from me, really. One of the things you mentioned was it's really important to get talking. And I suppose this is one thing that's always talked about, that communication is always key. But we do know that for women, it's so easy for us to talk about anything, and we'll talk about that anything for as many times as we need to. But what is it? What is the thing that you say would be the most impactful way that men can do that, start to talk? Is it when they're playing golf? Is it when they're at football? Where is it? Where do they get to start these conversations?
I think it's what works for individuals. Because it may not necessarily work for people to engage in golf, and there are people who that works for. I can only share what I find useful. I have some friends, and we do get together from time to time. And not only when we get together, it's also about being able to have people to call, people to have conversation with, and not being not isolating yourself. I think it's basically what works for you. Some people do it in the pub, but my advice is that don't overdrink, because that brings its own problem and brings aggression, violence, alcohol addiction, and that's another problem in itself. So drinking to moderation is always good, but is and there are various groups. There are various main groups. People form themselves into associations. People form themselves into a traveling group, which I've done before, where you just go on a men's weekend, and you just get together, and some play golf, some do other things. So there are a whole range, but nevertheless, I think it's also important, if you have family, that having conversation and getting family and being able to resolve issues in the family early is important. Otherwise, because when you look at the pressure on a lot of men, a lot of that stems from relationship difficulties, and acceptance of men as men, and the ego that comes with that. So there are a whole range of ways in which, but I would suggest that people, whatever you find useful, and it doesn't have to be families, it can be other people at work that you can turn to and rely on.
Mm-hmm. Definitely. And I like the fact that, you've mentioned about talking therapy, which is also really good, seeking professional help. And it's something that Steve also touched on. So fantastic. Thank you so much, Ade. And we'll have some times for questions at the end, if that's okay, for more questions. So we